Please have a seat. Good afternoon and welcome to this public defense of the thesis entitled Effects of Long-Term Stretching Training on Muscle Tendon Morphology, Mechanics and Function. Today's candidate, Marie Margrethe VM Moltubakk, completed her thesis in June 2018. Based on a proposal from the Department of Physical Performance, the Research Committee of the Norwegian School of Sports Sciences has appointed the following committee to judge the thesis and other requirements for the award. Associate Professor Matthew Spencer, Norwegian School of Sports Sciences, Chair. Director of Research, Dr. Malachi P. McHugh, Lenox Hill Hospital, USA, first opponent. And Associate Professor Tine Alskjær, University of Copenhagen, Denmark, second opponent. The committee has concluded that the thesis meets the standard worthy of a public defense for the award of Doctor of Philosophy, PhD in Sports Science. Earlier today, the candidate has given a trial lecture with the title, The Role of Musculoskeletal Flexibility and Stretching in Sports Performance and Injury. The trial lecture has been found satisfactory by the examination committee. I now would like to ask the candidate to introduce her doctoral research in the form of a short lecture, and the opposing members of the examination committee to engage the candidate in a defense of the work. Should members of the audience wish to ask questions relating to the research, I ask you to bring these in a written form to my attention in the break prior to the second opponent's question. I now ask the candidate to take her place at the lectern to introduce her work.
Prorector, committee, colleagues, family, and friends, thank you for coming. I'm happy to present my thesis titled Effects of Long-Term Stretching Training on Muscle Tendon Morphology, Mechanics, and Function. I'll begin by giving a brief overview of the background for my research. Then I will present the research aims, the methods applied in all of the studies, then the results and their interpretations for all studies before I conclude. According to literature, stretching is applied with aims covering performance enhancement, injury prevention, exercise recovery, fitness and health, daily function, relaxation and well-being, rehabilitation, and pain management. Flexibility is often defined as the maximal joint angle that can be obtained in a specific joint in a specific direction, the range of motion. Range of motion is determined by a large number of factors involving muscle tendon unit structures, neurons, joint factors, other factors within the body, and factors outside of the body. And this is just a brief overview of sub-factors. In my research, I focused on factors relating to the muscle tendon unit structure and to neural factors. And while all of these factors contribute to flexibility, I've been most interested in learning which of these factors may respond to stretching training. Research has shown that stretching training does increase range of motions. However, research on the mechanisms behind this increase is inconclusive and heterogeneous. A recent meta-analysis covering 28 stretching training intervention studies concluded that stretching probably does not change muscle or tendon properties, and that adaptations occur mostly at a sensory level. However, there are few studies lasting longer than 10 weeks, and the 3 that I know of have only measured range of motion, not muscle tendon unit adaptations. Therefore, the aims of my research were to examine the effects of long-term stretching on the hamstrings and triceps sura muscle tendon units, morphology, mechanics, and function. And to do so by comparing populations with years of stretching training to populations with no history of stretching, and by conducting a 6-month stretching training intervention. I will now proceed to the methods. My research is made up from three studies. In the first study, we investigated rhythmic gymnasts from national teams and compared them to age-matched female participants in handball, football, and skiing. In these groups, we studied the muscle tendon unit of the hamstrings, and these results are presented in paper 1. In the second study, we compared national ballet dancers to female age-matched controls who were recreationally active. In these groups, we studied the triceps sura muscle tendon unit, and results are presented in paper 2. Finally, we conducted a 6-month stretching training study where 26 men and women were doing stretching of one leg, while the other leg served as control. In these groups, we studied the triceps sura and the hamstrings. And results from this study are presented in paper 3 and in paper 4. This figure gives an overview of the methods and which studies they were applied in. This first column shows the methods that were used in the gymnast study. Second column, methods used in the dancer study. Third column shows the methods applied to the hamstrings in the intervention study. And finally, methods applied to the triceps sura in the intervention study. In all of the studies, we did flexibility tests. In the gymnast study, we did clinical and sport-specific tests, while in the dancer and the intervention study, we did measurements of passive range of motion using a dynamometer. Morphological and material properties were examined in the dancer and the intervention study by use of ultrasonography of the gastrocnemius and the soleus muscles. We examined, as you can see in the picture below, fascicle length, pennation angle, muscle thickness, tendon cross-sectional area, muscle and tendon length. Here you can see a sagittal view ultrasound image of the lower leg. At the surface of the image, you see the skin, and then lower in the image, we go deeper into the body. At the bottom here, we have the calcaneus. Here starts the soleus muscle, and up here you can see the beginning of the gastrocnemius muscle. So when I speak about the free Achilles tendon, I mean this portion up until this insertion of the soleus muscle. When I speak about the whole Achilles tendon, I mean the full length up until the myotendinous junction of the gastrocnemius medialis muscle. We measured tendon stiffness in the dancers and the intervention study. And tendon stiffness is the relationship between tendon force and tendon elongation measured during isometric ramped contractions between 80 and 100% of maximal force. And this was done at individual force level and at the maximal force level of each group. It was furthermore done once for the free Achilles tendon and for the whole Achilles tendon. And to assess tendon stiffness, we use an isometric dynamometer with a load cell. We have EMG electrodes on. We have an electrogoniometer here. And finally, we apply ultrasound to measure tendon elongation. In a subgroup of 14 subjects in the intervention study, we investigated Achilles tendon properties using MRI. We measured material properties looking at Achilles tendon signal intensity. We measured Achilles tendon cross-sectional area. And we measured Achilles tendon length in 3 dimensions. From the same subjects, we did muscle biopsies of the soleus muscle. We took one biopsy from the control leg before the intervention and a second biopsy from the stretching leg 2 days after the last stretching session. From these muscle samples, we calculated intramuscular collagen content. Passive resistance to stretch was measured using a dynamometer in all 3 studies. Here you can see that the subject's foot is attached to the dynamometer, and the engine of the dynamometer would then slowly rotate the joint all the way until the subject's maximal joint angle. During this movement, we would record joint angle, passive torque, EMG amplitude of the 3 muscles of the triceps sura, which would then be normalized to EMG during a maximal contraction. We would use ultrasonography to assess the elongation of the muscle fascicles, the muscle belly, the Achilles tendon, or the serous elastic component. And finally, we recorded self-perceived pain. So this picture shows the test for the ankle. This picture shows the passive knee extension done in the gymnast study. And please note that this position setup is different from the one used for passive knee extension in the intervention study. Contractile function was also recorded using an isokinetic dynamometer, and we recorded the torque angle relation. We measured peak torque, angle of peak torque, and work production. This was done for isokinetic knee flexion and extension in the gymnast study, while in the dancer study and the intervention study, we investigated isometric plantar flexion at different joint angles and isokinetic plantar and dorsiflexion at different velocities. Now I'll give you some information on the background of the participants in the 2 cross-sectional studies. The gymnasts had been practicing in their sport at comparable amounts of the controls, 10 to 12 years. The dancers had been dancing for 20 years, while the controls had obviously not been dancing. The weekly training of the gymnasts was significantly higher than the weekly training of the controls. Same for the ballet dancers, where the controls were recreationally active athletes and were doing an average of 4 hours of training in strength and in endurance activities. The gymnasts reported 4 hours of weekly stretching training, while the controls reported on average 9 minutes of weekly stretching. The ballet dancers reported on average 12 hours of stretching, while the controls did not stretch at all. This is an overview of the 6-month stretching intervention study. The participants were doing 2 stretching exercises, which I will explain in a minute, for 24 weeks. Before and after that, MRI scans were done and muscle biopsies were taken. The remaining measurements were taken during 1 lab session, which was repeated twice before the training started, and then at 8 weeks, at 16 weeks, and the day after the last stretching session. The stretching training program was a rather plain one: self-administered static stretches, ankle dorsiflexion as seen on picture A, and hip flexion as seen on picture B. Each of these stretches were held for 60 seconds and repeated 4 times. Subjects were instructed to feel a strong sensation of stretch, but no direct pain. The stretches should be performed daily for 24 weeks. The adherence to this program was about 89%, resulting in 11 hours of stretching per joint. Quick overview of the statistics applied to the results. When comparing 2 groups or 2 time points, we used paired or unpaired 2-tailed students' t-tests. And in the few cases where the data were not normally distributed, we used Mann-Whitney's U-tests. The active and passive torque angle relations were compared using two-way ANOVAs, mixed model for the cross-sectional studies, and repeated measures ANOVA for the intervention study. The latter type of ANOVA was also applied to all the data where we compared the stretching and the control leg pre and post in the intervention study. To help you all to understand the results of the intervention study, I will look a little bit closer at these statistic calculations. So we have measurements of the stretching leg before and after stretching training. And we can look at the change. And we can look at the change in the control leg from before to after training. However, we are mostly interested in knowing whether the change in the stretching leg is different from the change in the control leg. And this information we get using two-way ANOVA for repeated measures. This method gives us information about an interaction effect, which means that the stretching training affected the two legs differently. And it gives us information about a time effect, meaning that there was a change from till after training, irrespective of legs. To get more information about the sources of eventual effects, we use post-hoc tests. Furthermore, the data are in many cases recorded across the whole range of motion. On this figure from just one subject, you see the angle on the x-axis and the passive torque on the y-axis. And you see continuous data sets. In these cases, we did ANOVA at specific joint angles. One analysis at neutral ankle angle, anatomical ankle angle. Another analysis at standardized joint angle, which in most cases is the end point of the pre-test, and then same joint angle at the post-test. Finally, we have the maximal joint angle, which is the end point of each test at each time point. So at each of these time points, we would get an eventual interaction effect or a time effect. Now I move to the results, and my thesis consists of 6 hypotheses. I will now present each of them and the corresponding results from all 3 studies in the following order: range of motion, resistance to stretch during passive stretching, EMG amplitudes and muscle tendon unit elongation during passive stretching, morphological and material properties, contractile function, and cross-education effects. The first hypothesis says that range of motion is greater in populations with years of stretching compared to controls and is increased with 6 months of stretching. Starting with the ankle range of motion, indeed, we saw greater range of motion in the ballet dancers who are black compared to the control subjects that are gray. In the intervention study, the stretching leg saw an increase from pre to post in 12 degrees, while the control leg saw an increase of 4 degrees. And there was an interaction effect of stretching training. Moving to the flexibility of the hamstrings. We saw that the gymnasts were more flexible than the controls on the sit and reach test and on splits test. In the intervention study, we investigated knee extension range of motion, and you should note that greater flexibility means a more straight knee, which is a lower angle on this figure. So the stretching leg saw a 10-degree increase in range of motion, while there was no change in the control leg, and there was an interaction effect of stretching. The second hypothesis concerns passive resistance to stretch and says that passive torque at standardized joint angle would be lower in flexible populations and would decrease with 6 months of stretching, while the passive torque at the maximal angle would be greater in flexible populations and would increase with 6 months of stretching. So the measurements at the standardized angle would indicate mechanical adaptations, while the increase in maximal passive torque would indicate an increased tolerance to stretch. We start by looking at the ankle dorsiflexion passive torque. And on this figure, you see the ankle angle, and you see the passive torque. And the dancers are in black, and they have a rather large range of motion, and the control subjects in gray have a significantly lower range of motion. Looking at the passive torque on the y-axis, we see a lower passive torque at the standardized joint angle, which is in line with the hypothesis. However, looking at the maximal joint angle, the passive torque in the two groups is similar, which is contradicting the hypothesis. In the intervention study, you have the stretching leg on the left side in pink colors, and you have the control leg on the right side in blue values. The open symbols are pre-values before training, and the closed symbols are after training. So there was a time effect for passive torque at standardized joint angle, with reduced passive torque in both the stretching leg and the control leg. There was an interaction effect at the maximal joint angle, with increased passive torque in the stretching leg. Moving down to knee extension passive torque. In the gymnasts, we saw lower passive torque from a knee joint angle of 30 degrees and up until straight knee. In the gymnast study, there was no change in passive torque at standardized angle, which contradicts the hypothesis. There was, however, an interaction effect at the maximal angle with increased passive torque in the stretching leg, which corresponds with the hypothesis. Third hypothesis concerns EMG amplitude during passive stretching, and says that EMG amplitude at standardized angle, which would be an indicator of muscle active stiffness, would be lower in flexible populations and would be reduced with 6 months of stretching. We look at the dancer study first, and we have again the joint angle on the x-axis. Now we have EMG normalized to a maximal voluntary contraction on the y-axis. We recorded data and we analyzed data from 3 muscles of the triceps sura, but the statistical analysis are the same for all 3, so I will comment them together. In the dancers, we saw lower EMG amplitude at standardized angles, in line with the hypothesis. In the intervention study, we saw a time effect for EMG at standardized angle with reduced EMG amplitude in both the stretching leg and in the control leg, which is in line with the hypothesis. The fourth hypothesis covers elongation of the components of the muscle tendon unit during passive stretching, and says that flexible populations would have greater elongation of muscle and tendon, but muscle would play a greater role for the total elongation of the muscle tendon unit. While with 6 months of stretching, there would be an increased elongation of muscle and tendon, and the contribution from muscle and tendon to the total muscle tendon unit elongation would be altered. We'll start with the gastrocnemius medialis muscle fascicles, and in line with the hypothesis, dancers had a greater fascicle elongation than the control subjects. In the intervention study, in line with the hypothesis, there was an increased elongation both in the stretching leg and in the control leg. We then moved to the relationship between muscle belly length and serious elastic element length. And on this figure, you see muscle elongation in filled boxes, and you see tendon elongation in white boxes. And the numbers on the bar indicates the contribution from muscle to the total elongation of the muscle tendon unit. So in the dancer study, there was a greater muscle elongation in gastrocnemius in the dancers compared to controls, but the elongation of the tendon was not significantly different, and the contribution from muscle to total elongation was not significantly different, which contradicts the hypothesis. In the intervention study, we have the same figure where we see gastrocnemius medialis on the left side and the soleus muscle on the right side. And this figure represents measurements at the maximal joint angle. There was an interaction effect for muscle elongation with increased elongation in the stretching leg. There was also an interaction effect for tendon elongation being increased in both the stretching leg and the control leg. There was a time effect for contribution to total elongation, where after the stretching training period, the tendon contributed to a greater extent to the total elongation in the stretching leg in both muscles and in soleus in the control leg. The fifth hypothesis covers morphological and material properties and states that flexible populations may display different morphological properties compared to controls. While with 6 months of stretching, we did not expect changes in muscle morphological properties, tendon morphological properties, tendon material properties, but we hypothesized decreased intramuscular collagen content. This column shows the result for the dancer study, and I would like to bring your attention to the Achilles tendon properties. Dancers had a longer and less stiff whole Achilles tendon compared to controls. They also had longer gastrocnemius medialis muscle fascicles, but shorter soleus muscle fascicles. In the intervention study, as expected, none of these variables changed. Note also that intramuscular collagen content was not decreased, which is not in line with the hypothesis. However, there was in the intervention study, there was no change in tendon stiffness, which is the slope of this curve. However, there was a small increase in Achilles tendon elongation in the intervention study, which could be an indicator of altered toe strain limit. The sixth hypothesis covers contractile function and says that flexible populations reach peak isokinetic torques at joint angles corresponding to a more extended position, and that with 6 months of stretching, angular peak torque would increase. In these figures, you have the knee joint angle on the x-axis, and then you have isokinetic torque production on the y-axis. And again, we have gymnasts in black and controls in gray. And in line with the hypothesis, we saw that gymnasts produced their peak torque at a more extended knee joint angle compared to the controls. This is in line with the hypothesis. However, in the dancer study, there was no difference between dancers and control in angular peak torque for plantar flexion, contradicting the hypothesis. In the intervention study, the figure is a little bit different. You see here on the x-axis the angle of peak torque, and on the y-axis there is still isokinetic torque. And there was a time effect at the 3 lowest movement velocities, and there was a small shift in angular peak torque toward a more flexed ankle joint position, which is in line with the hypothesis. Then, although it was not hypothesized, we saw indications of a cross-education effect. We saw altered values in the intervention study in the unstretched ankle for range of motion, for passive dorsiflexion variables, for tendon elongation at standardized tendon force levels, and in angular peak torque. So, due to the design of this study, we cannot eliminate or we cannot be quite sure what these altered values represent. There might not be any real change in flexibility, and the values would then be a result of systematic errors resulting from changes to our measurement equipment in the lab or lab procedures, which would then be systematic and would affect both legs. Alternatively, these values could represent altered flexibility, but they could be a consequence of external factors, so factors outside of the stretching intervention, such as the participants' training, diet, the season, and so on. And we cannot completely eliminate this because we only had a control leg and not a dedicated control group. But finally, these changes could represent improved flexibility due to a cross-education effect, where stretching of one leg would lead to a neural central response, which would then affect both legs. Since our measurements correspond with each other and are consistent across measurement devices, we suggest that these changes are real and represent a cross-education effect of stretching training. So, in conclusion, these studies suggest that long-term stretching leads to neural adaptations and structural adaptations, which together alter mechanical properties and have the potential to modify contractile function. The bilateral responses have previously been seen with with strength training, but have not previously been shown for stretching training. These bilateral responses seen in the present intervention study confirm the role of central mechanisms for increased range of motion. Take-home message for the non-academic audience. According to our studies, stretching training does increase range of motion, and this change involves altering mechanical properties, so stretching training is not only about altering your tolerance to pain. There is, however, no evidence that muscles or tendons grow any longer due to stretching training. Huge thanks to my two excellent supervisors, Jens and Olivier. Thanks to the amazingly hardworking master students, Fabienne, Melina, Christian. Thanks to my co-authors, and thank you for your attention.